Question 1. As illustrated by the case of Istavella, a 68-year-old male undergoing a myocardial perfusion study using a SPECT system, an unusual linear artifact appears consistently on transaxial images. The technologist ensured proper radiopharmaceutical administration and patient positioning, and no motion was detected. Upon reviewing the raw projection data and cinegrammes, a high-count hot stripe is visible across mole projections localized to consistent detector angle. What is the most appropriate next step for the technologist to determine the root cause and prevent recurrence? A. Repeat the scan immediately without attenuation correction to see if the artifact disappears. B. Perform an energy spectrum check and flood field uniformity test to evaluate detector functionality. C. Reconstruct the data using filtered back projection instead of iterative reconstruction. D. Attribute the artifact to patient-related motion and document it as technical limitation. Answer. Correct answer, B. Explanation. A consistent artifact in raw projection data often points to a detector malfunction such as a defective PMT or collimator misalignment. MMI guidelines for advanced UC protocols emphasize performing energy spectrum evaluations and flood field uniformity testing to identify non-uniformities or defective crystal modules. Option A may bypass the CT data but does not resolve the root instrumentation issue. Option C changes methodology but not root cause. Option D misattributes the problem. Regular QC and preventive maintenance are required per ACA and NRC recommendations to ensure artifact-free imaging. Question 2. In a modern context of pediatric nuclear medicine, a technologist is preparing a 5-year-old patient for a renal scan using TC 99 meters mag. The physician orders a weight-based activity according to the ENAM pediatric dosage card. The child is anxious and non-compliant with intravenous injection, and the parent requests the dose be administered orally instead. Which response best aligns with best practices and safety guidelines? A. Proceed with oral administration and extend the imaging time for adequate uptake. B. Explain that the oral route is not acceptable and reschedule the scan for Roman access is not possible. C. Switch to TC 99 meter EPA and allow the child to drink water to facilitate excretion. D. Use a butterfly needle to attempt Roman access under sedation with parental consent. Answer. Correct answer, D. Explanation. Roman access is essential for accurate timing and quantification in renography, especially for agents like MAC. Sedation under pediatric protocols may be required and should be done with appropriate monitoring and consent. Oral administration is not validated for renal agents due to unreliable bioavailability. MMI and EAM pediatric imaging guidelines strictly discourage unverified administration routes. Switching to DPA doesn't address administration challenges. Delaying scans should be the last resort when sedation and child life techniques fail. Question 3. From a practical standpoint, what is the primary function of a NITL crystalline gamma camera systems? A. Convert light photons to electronic signals for digital display. B. Coulombic gamma photons for directional localization. C. Convert incoming gamma photons to visible light. D. Act as a gain control mechanism for the PMT array. Answer. Correct answer, C. Explanation. The NITL scintillation crystal is the foundational detection material in gamma cameras, converting incident gamma photons into flashes of visible light which are then detected by PMTS. This light electrical signal process is central to image formation. Option A describes PMT and electronics function. Collimation, option B, is done by the collimator, not the crystal. Gain control is an electronic function unrelated to the scintillator itself. This principle is outlined in MMI instrumentation modules and OPM reports. Question 4. Given the circumstances, is Lynn, a senior technologist, notices decreased sensitivity in image contrast in a series of PET brain scans. After reviewing daily QC logs, she sees that the normalization file used is outdated by 8 months, though system logs show no errors. She recalls the manufacturer recommends monthly updates of normalization files for optimal quantification. Which of the following best describes the issue and appropriate next step? A. This is likely an equilibration issue and the CT manufacturer should be contacted. B. Use histogram equalization during post-processing to enhance contrast artificially. C. Generate a new normalization scan and reprocess the affected patient studies if possible. D. Continue using the system as long as you see values remain within limits. Answer. Correct answer. C. Explanation. Normalization in PET systems corrects for variation in detector efficiency and uniformity. Outdated files can result in non-uniform images and quantification errors. NEMA-NU2 and manufacturer guidelines recommend regular normalization updates, especially for time-of-flight systems. Option A misattributes the problem. Option B introduces artificial enhancement that does not address root cause. Continuing use option D without addressing calibration jeopardizes clinical integrity and violates SNMMI practice standards. Question 5. When evaluating the merits of implementing a new artificial intelligence AI tool for lesion detection in SPECT oncology studies, a hospital's nuclear medicine department is concerned about interpretive errors. The AI algorithm boasts 93% sensitivity and 88% specificity in initial trials. Which metric or test would most critically assess its clinical viability? A. The number of cases reviewed per hour by technologists. B. Receiver operating characteristic ROC curve analysis and area under the curve arc. C. Confidence interval for the AI average reading time. D. Repeatability of image file compression using AI software. Answer. Correct answer. B. Explanation. The ROC curve and org provide a robust statistical framework to evaluate the diagnostic performance of an AI system, showing how well the tool discriminates between true positives and negatives across thresholds. Sensitivity and specificity are point values. ROC gives a more comprehensive picture. Time metrics and compression stability, options A, C, D, are operational, not diagnostic performance. Indicators. AI validation in nuclear medicine must align with SNMMI task force guidelines and FDOS good machine learning practices. Question 6. To illustrate this point, Dr. McAllister is supervising the setup of Lu-177 dotatate therapy for a patient with metastatic neuroendocrine tumors. The Radiation Safety Officer, RSO, mandates additional shielding and surveys. The technologist is unsure whether the dose requires bioassay or special licensing. What key regulatory principle helps clarify this situation? A. The threshold for bioassay depends on annual OLI intake per NRC and CFR Part 20. B. Therapy doses below 30 ml do not require shielding per ACA guidance. C. Bioassays are always required for beta-emitting therapies regardless of dose. D. Lu-177 therapies are exempt from licensing if prepared by a certified radiopharmacist. Answer. Correct answer. A. Explanation in RCTEFR Part 20 specifies that bioassays are required when the intake of radioactive material is likely to exceed 10% of the annual limit on intake. OLI Lu-177, though beta-emitting, is often administered in doses that may necessitate radiation monitoring. Shielding and OLI thresholds must be evaluated case by case. Option B is inaccurate. Shielding is based on exposure rate, not dose alone. Licensing is required regardless of the source's certification. D. Option C overgeneralizes beta emitter regulations. Question 7. While examining the histogram of a filtered back projection image from a cardiac SPECT scan, a technologist notices severe streaking artifacts near high uptake regions, particularly the liver. Which factor most contributes to this artifact? A. Improper center of rotation correction. B. High count rate nonlinearity in PMTS. C. Truncation and ramp filter overshoot near intense activity zones. D. Patient's breath holding during gated acquisition. Answer. Correct answer. C. Explanation. Streaking artifacts in filtered back projection are commonly due to truncation and edge effects from the ramp filter, especially when adjacent tissues have high activity. G. Liver next to myocardium. This is an intrinsic limitation of FBP. Corazate and count nonlinearity. B. Cause misregistration or distortion, not streaking. Breath holding during gated SPECT. D. May cause motion artifacts, but streaking patterns. MMI image artifact correction guidelines recommend considering iterative reconstruction to reduce these effects. Question 8. Across different scenarios, patient Istanuin is administered F18-FDG for an oncological PET scan. However, he completed strenuous exercise an hour before injection, leading to abnormal muscle uptake and poor tumor contrast. What is the best approach to address this issue in future protocols? A. Advise patients to avoid exercise for at least 24 hours before imaging. B. Increase the FDG dose to improve contrast. C. Delay imaging for 4 hours post-injection to allow muscle activity to dissipate. D. Repeat scan using a different radiopharmaceutical not taken up by muscles. Answer. Correct answer, an explanation. Muscle uptick of FDG due to recent physical activity is a well-known confounder in PET imaging. Guidelines from MMI and EAM recommend patients refrain from strenuous activity for at least 24 hours prior to scanning. Option B increases dose but not specificity. Option C may not resolve muscle uptick. Option D changes modality unnecessarily. Proper patient preparation protocols are crucial for high-quality, interpretable imaging. Question 9. Through careful analysis of a multi-center clinical trial on amyloid PET imaging, researchers discover inter-scanner variability affecting subcalculations, which could influence eligibility for therapeutic interventions. What standardization approach is most appropriate to address this? A. Normalize sub values to blood pool activity instead of cerebellum. B. Apply scanner harmonization using phantom-based calibration. C. Switch from PET to PETMA systems for all sites. D. Use static imaging protocols to avoid time-activity discrepancies. Answer. Correct answer. B. Explanation. Phantom-based harmonization using calibration standards. E.g. Hoffman brain phantom ensures consistency across scanners and sites. The SNMMI amyloid imaging task force and ENAM research limited endorse harmonization to enable cross-platform comparability in multi-site trials. Option A modifies reference region, not scanner variability. Option C is impractical. Option D oversimplifies timing issues. Standardization through calibration is a key quality assurance measure in quantitative PET research. Question 10. In contrast to static imaging systems, hybrid modalities like SPECMA or PET require advanced technical integration. What is a key engineering challenge in developing PETMA systems? A. Coregistering attenuation maps without anatomical landmarks. B. Achieving high time resolution for simultaneous cardiac and neuro scans. C. Shielding PMTS from magnetic interference while maintaining spatial fidelity. D. Balancing radiation dose with spatial resolution in deep tissues. Answer. Correct answer. C. Explanation. PETMA systems must overcome PMT insensitivity to magnetic fields, as standard PET detectors PMTS fail in high magnetic fields. This necessitates use of solid-state detectors like SIPMs. Option A is a software-level problem. Time resolution. B is critical but not unique to PETs to dose resolution balance. D applies across all modalities. The engineering integration challenge is primarily electromagnetic compatibility per ICRU reports and MMI instrumentation design reviews. Question 11. In the context of PET imaging, which of the following is a primary advantage of using time-of-flight TOF technology? A. It enhances the spatial resolution by increasing detector sensitivity. B. It decreases the amount of radiation dose delivered to the patient. C. It provides faster image acquisition by reducing noise in the images. D. It allows for improved tissue differentiation by increasing image contrast. Answer. Correct answer. C. Explanation. Time-of-flight TOF technology improves the quality of PET images by reducing noise and enhancing image clarity. TOF works by measuring the time difference between the two photons emitted during positron annihilation. This allows for better localization of the event, resulting in faster image acquisition and improved signal-to-noise ratio. While TOF enhances image quality, it does not directly affect the radiation or tissue differentiation. Question 12. Given the circumstances of a radiation spill, which of the following actions should be prioritized immediately following the detection of radioactive contamination in a nuclear medicine facility? A. Evacuate the premises and initiate a facility-wide radiation survey. B. Restrict access to the contaminated area and notify the radiation safety officer. C. Dispose of any contaminated materials in a safe waste disposal unit. D. Begin a full decontamination procedure to prevent exposure. Answer. Correct answer. B. Explanation. The first priority following A radiation spill should be to restrict access to the contaminated area and notify the radiation safety officer. This minimizes exposure risk to personnel. Evacuation or decontamination procedures may be necessary, but these should occur after securing the area and confirming the extent of contamination. Ensuring that no one else enters the contaminated zone is critical to maintain. Question 13. What would happen if a gamma camera was improperly calibrated before? A SPECT scan, A. The image resolution would improve significantly. B. The acquired images would have inaccurate localization and potential artifacts. C. The radiation exposure to the patient would be minimized. D. The camera's sensitivity would increase, providing better quality images. Answer. Correct answer. B. Explanation. Improper calibration of a gamma camera can lead to inaccuracies in image acquisition, resulting in mislocalization and artifacts. This occurs because calibration ensures that the system's geometry and detector efficiency are correctly aligned. Without proper calibration, the images may be distorted, impacting clinical diagnosis and treatment planning. Radiation exposure may not necessarily be affected, but could lead to unnecessary rescanning. Question 14. Under the assumption that a patient is receiving a diagnostic cardiac stress test using a radiopharmaceutical agent, which of the following factors is most crucial for ensuring the accuracy of the results? A. The patient's weight and age must be adjusted to select the optimal radiopharmaceutical dose. B. The patient must remain still throughout the procedure to avoid motion artifacts. C. A full understanding of the patient's prior medical history is not necessary. D. The radiopharmaceutical must be injected at least 24 hours before the test for accurate results. Answer. Correct answer. B. Explanation. The most crucial factor for ensuring the accuracy of a cardiac stress test is minimizing patient motion during the imaging procedure. Movement can cause artifacts in the images, which can distort results and lead to misinterpretation. While patient history, radiopharmaceutical dosing, and timing are important, motion control directly impacts the quality of diagnostic imaging. Question 15. The relationship between SPECT hybrid imaging and its application in oncology is demonstrated by which of the following? A. SPECT hybrid imaging improves the accuracy of tumor localization and allows for better treatment planning. B. SPECT is primarily used for neurological imaging and has no major applications in oncology. C. SPECT provides low spatial resolution compared to PECT in detecting cancerous cells. D. SPECT is used to visualize only the anatomical structure of a tumor, not its functional properties. Answer. Correct answer. A. Explanation. SPECT hybrid imaging enhances tumor localization by combining the functional imaging from SPECT with the anatomical detail from CT. This dual modality improves the accuracy of both diagnosis and treatment planning, especially in oncology, where precise tumor localization is critical. Unlike PECT, which provides better metabolic information, SPECT is effective for both functional and anatomical assessment. Question 16. A common misconception about nuclear medicine imaging is that it requires high levels of radiation exposure to be effective. Which of the following is the best explanation to dispel this myth? A. The use of high-energy gamma rays ensures better image quality but increases radiation exposure. B. Newer radiopharmaceuticals and technologies like SPECT and PECT allow for lower doses with higher quality images. C. Radiation exposure is solely dependent on the patient's size and age, not the imaging technique. D. Radiation dose is standardized for all types of imaging, making it consistent regardless of technology used. Answer. Correct answer. B. Explanation. Modern advancements in radiopharmaceuticals and imaging technologies like SPECT and PECT enable the production of high-quality images with reduced radiation doses. These technologies improve the efficiency of imaging and enhance the detection capabilities, thereby lowering the overall radiation exposure required for effective imaging. New techniques focus on minimizing patient risk while maintaining diagnostic accuracy. Question 17. Considering the evidence in nuclear medicine pharmacokinetics, how do variations in organ perfusion affect radiopharmaceutical distribution? A. Organs with poor perfusion will show higher uptake of radiopharmaceutical agents. B. Areas with high perfusion will show lower uptake of radiopharmaceuticals due to dilution. C. Perfusion variations do not affect radiopharmaceutical distribution. D. Poor perfusion can reduce radiopharmaceutical uptake and lead to inaccurate imaging results. Answer. Correct answer. D. Explanation. Poor perfusion in certain organs leads to reduced radiopharmaceutical uptake, which can result in inaccurate or non-representative imaging. For example, in cardiac imaging, decreased blood flow to certain regions, e.g. due to a blockage, will cause lower uptake of the radiopharmaceutical, leading to a false negative or an incomplete diagnosis. Understanding these factors is crucial for interpreting nuclear medicine images accurately. Question 18. What is the primary reason for the adoption of artificial intelligence (AI) in nuclear medicine imaging? AI can automate the production of radiopharmaceuticals, reducing human error. AI allows for real-time correction of image artifacts during acquisition. AI assists in quantitative analysis, improving diagnostic accuracy by reducing human interpretation bias. AI improves the safety protocols during the administration of radiopharmaceuticals. Answer. Correct answer. C. Explanation. Artificial intelligence (AI) in nuclear medicine is primarily used for quantitative analysis, enabling faster, more accurate interpretations of imaging data. AI algorithms help reduce human bias, enhance precision in the detection of pathological areas, and improve workflow efficiency. It does not directly impact radiopharmaceutical production or safety protocols, but rather augments the analysis and diagnostic process. Question 19. How might one explain the role of radiopharmaceutical quality control in maintaining imaging accuracy in nuclear medicine procedures? A. Quality control ensures that the radiopharmaceutical agent is free from contaminants which might interfere with imaging results. B. Quality control is irrelevant as long as the radiopharmaceutical is administered at the correct time. C. The primary function of quality control is to enhance the emotional response of patients during the procedure. D. Quality control only involves checking the physical appearance of the radiopharmaceutical administration. Answer. Correct answer. A. Explanation. Radiopharmaceutical quality control ensures that the agent is free from impurities, contaminants, or degradation which can affect the imaging process. Contaminants can alter the pharmacokinetics of the radiopharmaceutical, potentially leading to inaccurate imaging results. Quality control also involves verifying the radiopharmaceutical's activity, purity, and integrity to ensure reliable diagnostic results. Question 20. Based on the information from the latest regulations, how should nuclear medicine technologists handle radiation safety in the workplace? A. Radiation safety protocols should be implemented only in high-risk procedures. B. Radiation safety measures should include regular personal monitoring and adherence to ALARA principles. C. Radiation safety is the responsibility of the medical physicist only, not the technologist. D. Technologists should focus on radiation safety primarily when working with pediatric patients. Answer. Correct answer. B. Explanation. According to radiation safety regulations, nuclear medicine technologists must adhere to the ALARA, as low as reasonably achievable, principle and implement radiation safety measures at all times, regardless of the patient population or procedure type. This includes regular personal monitoring, using shielding, and ensuring proper waste disposal. Radiation safety is a shared responsibility among all persons involved in nuclear medicine procedures, not just the medical physicist. Question 21. In a case of a patient undergoing a PET scan, which of the following factors most affects the quality of the PET image? A. The patient's body temperature during the scan. B. The amount of time the patient spends fasting before the scan. C. The amount of radiopharmaceutical injected and its distribution. D. The patient's age and gender. Answer. Correct answer. C. Explanation. The quality of a PET image is primarily influenced by the radiopharmaceuticals injection and distribution. A higher dose of radiopharmaceuticals or a more evenly distributed dose leads to clearer and more accurate images, while fasting and other factors can have a secondary impact. The radiopharmaceutical itself plays the most critical role in imaging quality. Question 22. What is the primary purpose of using a collimator in a gamma camera? A. To increase the sensitivity of the detector. B. To control the direction and energy of incoming photons. C. To adjust the spatial resolution of the image. D. To amplify the signal from the detector. Answer. Correct answer, B. Explanation. A collimator is used in gamma cameras to control the direction and energy of incoming photons, ensuring that only photons traveling in a specific direction are detected. This helps improve image quality by reducing scatter and allowing for better localization of the radioactive emissions from the radiopharmaceutical. Question 23. In radiation therapy, which of the following is the most significant challenge in treating tumors located near critical structures? A. Accurate tumor delineation on the imaging scan. B. The ability to precisely monitor radiation dose during treatment. C. Ensuring that the radiation does not affect surrounding healthy tissue. D. The duration of the radiation therapy session. Answer. Correct answer, C. Explanation. The most significant challenge in radiation therapy when tumors are near critical structures is ensuring that the radiation dose is precisely targeted to the tumor while minimizing exposure to surrounding healthy tissue. This requires advanced imaging techniques, precision in treatment planning, and careful consideration of radiation dose distribution. Question 24. Which of the following methods is commonly used to assess the functional status of the heart in nuclear medicine? A. Dynamic MRI imaging. B. SPECT myocardial perfusion imaging. C. Chest X-ray with contrast. D. CT angiography with contrast. Answer. Correct answer, B. Explanation. SPECT myocardial perfusion imaging is commonly used in nuclear medicine to assess the functional status of the heart. This technique evaluates blood flow to the heart muscle, helping identify areas of ischemia or infarction, which can be critical for diagnosing coronary artery disease. Question 25. What is the primary advantage of using a hybrid imaging system like PECT in the diagnosis of cancer? A. It provides higher image resolution compared to standalone imaging modalities. B. It can provide both functional and anatomical imaging in one procedure. C. It decreases the amount of radiation required for the scan. D. It helps improve the aesthetic quality of the images for better visualization. Answer. Correct answer, B. Explanation. The primary advantage of hybrid imaging systems like PECT is that they provide both functional PET and anatomical CT imaging in one procedure. This combination allows for more accurate localization of tumors and a better understanding of their metabolic activity, improving diagnosis and treatment planning. Question 26. If a radiation technologist is exposed to a dose of 5 MSV during a workday, what is the most appropriate action according to radiation safety protocols? A. No action is needed as 5 MSV is below the acceptable annual dose limit. B. The technologist should immediately undergo medical testing to evaluate potential effects. C. The technologist should be reassigned to non-radiation related duties for the remainder of the day. D. The exposure should be reported to the radiation safety officer and documented. Answer. Correct answer, D. Explanation. The technologist's exposure should be reported to the Radiation Safety Officer (RSO) and documented, even if the dose is within permissible limits. Keeping record of exposure and monitoring cumulative doses over time is crucial for ensuring long-term safety and compliance with radiation safety regulations. Question 27. Which of the following is the main disadvantage of using 18-EDG in PET imaging? A. It requires the use of a large number of radioactive materials. B. Its half-life of 110 minutes limits its clinical applications. C. It does not provide adequate tumor imaging in neurological conditions. D. It is less effective in detecting cancers with low metabolic activity. Answer. Correct answer, D. Explanation. 18-FG is a glucose analog used in PET imaging to detect metabolic activity. Its primary limitation is that it is less effective in detecting cancers that have low metabolic activity, as it relies on glucose uptake to identify tumors. This can lead to false negatives in such cases. Question 20. In radiation oncology, what is the role of the dosimetrist in the treatment planning process? A. To administer the radiation treatment to the patient. B. To measure and calculate the exact radiation dose to be delivered to the tumor. C. To diagnose the type of cancer being treated. D. To ensure that patients comply with the prescribed radiation schedule. Answer. Correct answer. B. Explanation. The dosimetry plays a critical role in calculating the precise radiation dose to be delivered to the tumor while minimizing exposure to surrounding healthy tissue. It worked closely with the radiation oncologist to develop a treatment plan tailored to the patient's specific needs. Question 29. Which of the following imaging modalities is most commonly used to assess bone metastases in cancer patients? A. MRI. B. X-ray. C. SPECT bone scanning. D. Ultrasound. Answer. Correct answer. C. Explanation. SPECT bone scanning is commonly used to assess bone metastases in cancer patients. It provides functional imaging of bone metabolism and can detect abnormal bone growth, such as that caused by metastases, more effectively than conventional X-rays. Question 30. How does the use of dual-energy X-ray absorptiometry (DEXA) aid in nuclear medicine? A. DEXA is used for imaging soft tissues and organs in detail. B. DEXA measures bone mineral density and helps in the assessment of osteoporosis. C. DEXA is primarily used to calculate radiation doses in patients undergoing therapy. D. DEXA helps in imaging metabolic activity in different tissues. Answer. Correct answer. B. Explanation. Dual-energy X-ray absorptiometry (DEXA) is primarily used to measure bone mineral density (BMD) and assess the risk of osteoporosis. In the context of nuclear medicine, it provides valuable information on skeletal health, which is especially important for patients undergoing long-term cancer treatment or radiation therapy, which can lead to bone density loss.